I have to turn to some breaking news, though. Sources tell NBC News that the president-elect, Donald Trump, is expected to pick Robert F. Kennedy Jr. to be the Secretary of Health and Human Services. Trump had previously promised RFK a, quote, big role after RFK abandoned his independent bid for president and endorsed Donald Trump. The New York Times describes him like this, as a, quote, environmental lawyer who has no medical or public health degrees and has promoted anti-vaccine conspiracies for years, end quote. Regarding the Food and Drug Administration, the agency that is responsible for the safety of our prescriptions, vaccines, cosmetics, our food, even veterinary medicine, an agency that would be under his purview, RFK has said that, quote, entire departments have to go. Let's bring into our breaking news coverage former Obama White House Policy Director, MSNBC medical contributor, Dr. Kavita Patel. Dr. Patel, your first reaction.
Oh, my God. I mean, those of us who have spent our lifetime, kind of decades working in and around in HHS, I'm not kidding, Nicole, my texts are flying off the chain, both Democrats and Republicans saying, this can't be real. Someone must have gotten this wrong. This can't be possible. And now the second underlying chain, if there's some silver linings, the second thought I had is he can't get confirmed, can he? But I'm just listening to you talk about the DNI and all these other roles that require some sort of White House or confirmation or some combination. And here we are. It is really hard to believe. There are career staff texting me saying this was just the push they needed to try to get out. They were already on the fence and worried. So we're not just going to see this incredible kind of integration of ideology that has no science behind it. But Nicole, we're going to see probably the best of the best career staff leaving these agencies potentially hollow that he would oversee.
Just for people that aren't familiar with how HHS interacts with the medical community and people's lives, just take us through a little bit of that, if you will.
Yeah, so the Secretary of Health and Human Services, as you mentioned, has a purview over many agencies that touch our lives. You just touched on a couple of them: Food and Drug Administration, the CDC, Centers for Disease Control and Prevention. You may kind of know these letters as we've talked about all vaccines and things during COVID, but it touches everything. Nicole, it touches our food supply chain. I'll give you an example. When we had a supply chain shortage of baby formula, this hits a lot of people at home because none of the shelves could keep the formula stocked. It's the HHS secretary who kind of pulled it all together and worked with other departments to try to make sure that we could get Americans formula just to feed their children. Add into that just all the research. Think of the National Institutes of Health, Nicole, that's also under HHS. Research on drug development. And I actually pulled up, just to remind myself, a tweet from RFK Jr. when he was running for president, where he said that if he were president, I guess thank goodness he's not, he'd stop research on drug development and infectious diseases for 8 years. And I think he was proud of that. So anything that you do in the medical community, and then let me tell you where it hits home. During COVID, you and I have talked about the Medical Reserve Corps and the Public Health Service Agency, all the people who actually help to facilitate getting vaccines across the country, getting COVID tests across the country. That's under HHS as well. So anything from a safety net clinic to the medicines that you trust are safe, that is now potentially going to be under this environmental lawyer with no training whatsoever and very dangerous views.
I have a little one, so I'm on a vaccine schedule again, and I trust my pediatrician with that. RFK has criticized childhood vaccination schedules, linked vaccines to autism and other health issues against studies. CDC Director Rochelle Walensky warned in 2022 that vaccine misinformation is one of the biggest threats to children's health. In the sort of pickled community of anti-vax disinformation, there are people that refuse vaccines, and there are outbreaks of polio and measles in this country, diseases that were once thought eradicated. What should people watching do if they have young kids?
I do think that if there is any solace, it's what you just said, that as doctors, we're trained. So we are trained. I know that we've talked about doctors in many states not being allowed to talk about certain issues. I really hope and pray that vaccines and public health do not become another set of issues in addition to reproductive and women's health. But right now, your pediatricians, your primary care doctors, they have your best interest. They treat you in front of them, and they're not worried about the politics. In fact, I bet most of my medical colleagues don't even realize what's happening because they're doing what they should be doing and taking care of people. So I do think that it's worth just having that direct conversation with your pediatrician. And I also do encourage people to look at the evidence. I do not try to dismiss people when they talk to me about concerns about vaccines, but it's worth bringing back up that initial study that has been since debunked and refuted. And in fact, journals have retracted any of the mentions, not because they're afraid, but because we want to put good science forward. And Nicole, I'm all for telling you that we could probably do things differently. I know that I've talked with my own pediatrician, with my children about, do we need to do all of these vaccines in this one visit? Can we spread it across 2 visits? All of those conversations are appropriate, but that is not what we're talking about. That's not what RFK Jr. is talking about. He's talking about implying a direct causality between vaccines and autism. And in addition to that, other claims that we have. And then he couches it by saying he's not anti-vax. He's just anti all the vaccines that we currently have, which is effectively being anti-vaccine.
Let me do 2 things. Let me show you Trump's mandate that he gave RFK, told him to, quote, go wild. And let me bring into our coverage Vaughn Hilliard. First, Donald Trump.
I'm going to let him go wild on health. I'm going to let him go wild on the food. I'm going to let him go wild on medicines. The only thing I told him, though, Bobby, you got to do one thing, do whatever you want. You just go ahead, work on the pesticides, work on making women's health. He's so into women's health. And, you know, he's really unbelievable. It's such a passion.
Vaughn Hilliard joins our coverage. Vaughn, take us inside your reporting on how this came to be.
Right. It was just last week that he suggested to me here in Palm Beach, number one, that he was going to actually live here in Palm Beach throughout the next months, throughout the course of the transition, because he wanted to be close to the operation and as helpful as he could be. And I asked him about the HHS secretary role. Of course, there were questions of whether he would be able to be confirmed by the Senate. And he had suggested to me that he was actually interested in a role of a White House health czar, which, of course, would allow him to be inside the White House without having to be confirmed by the Senate. But as you just played from those bites, Donald Trump was very specific that he would let him do whatever he wanted, including on vaccines. And I think that this is a year-plus long conversation that we've been having with Mr. Kennedy. And it was one that last week I directly asked him about when it comes to vaccines, because as Dr. Patel and you guys were just talking about, he says he is not anti-vax, just anti the vaccines that are on the market here today. And back during the COVID pandemic, he was very public in his opposition to the FDA granting emergency authorization for Americans' access to the multiple and various COVID vaccines that were brought to the market. And last week I asked him whether he, inside of the White House, overseeing the FDA, would seek to use the FDA to block such authorization if there was another pandemic or as new vaccines come to the market, or whether he would seek to remove any vaccines from the market. And interestingly, he followed up and told me that he would not do either of those, that he would not block any new vaccines and would not pull any from the market. Instead, he said that he would ensure that all Americans have all of the access to information. Of course, there's a lot to unpack there, and you are taking Robert F. Kennedy Jr.'s words after decades of work fighting vaccines from being available to Americans on the market. And the second part of that was from our interview, Nicole. I asked very specifically the question of him, too, of whether he would seek to remove a part of the civil federal workforce working at these 13 different health agencies under HHS, including the CDC. And he told me that he would, in fact, seek to even eliminate some departments, including the nutrition department. Now, of course, there's a large conversation about health in America, and he has attracted a large following of people who are concerned about ingredients and sugar and American food products and drink products. But then there's that next part of Robert F. Kennedy Jr. that is undoubtedly going to get questions from including Republican senators on Capitol Hill, and that's his posture on vaccines, especially coming off of a time in which Americans just lived through a pandemic under the Trump administration.